One of the differences between physicians and nurse practitioners is that physicians are regulated by a state board of medicine, while in most states, nurse practitioners are regulated by a state board of nursing. This distinction is important because while nurse practitioners are functioning in the same capacity as physicians, ordering and interpreting tests, making medical diagnoses, writing prescriptions for medications, they are being overseen by a regulatory body, which includes nurses without experience in that kind of practice, which can result in a lack of appropriate action when a nurse practitioner is practicing improperly.
Right. I think, so what I see is that when I have looked at disciplinary hearings, which are, I think, publicly available on nursing board and medical board websites. If you take time to read through those, you can very easily see a distinct difference in process and accountability. Things like this will unfortunately happen with physicians. I mean, that's the first thing to come to terms with. When we as physicians see this happen with a nurse practitioner, we're not saying, oh, this would never happen with us. We're saying, if it happens to a physician, that when that physician comes to the medical board, the processes are robust, they are swift, and they are non-negotiable. And you can see this. You can literally go to the nursing board and medical board websites, and you can read the disciplinary summaries of a physician and see it be carried out in a timely manner. And so that's to me what sticks out about it.
Yeah, I think what's really interesting to me is, like Teresa was saying, when I, in Washington State, there was this whole big, maybe about 5-6 years ago, there was a big thing where many physicians just had their licenses revoked for prescribing testosterone unnecessarily, and then growth hormone for sort of those wellness and vitality kind of clinics. And so I really want to emphasize in this episode in particular, as you know, Teresa said, doctors do this. This isn't saying only nurse practitioners make these mistakes or cross these boundaries or sleep with patients. It definitely happens. Physicians, I mean, there may be more examples where physicians have done that. However, there are far more. I mean, countless more examples where physicians are no longer practicing. They've lost their licenses. And the reaction is, as you said, swift. And so what I find interesting is sometimes, and that seems like there's some problem maybe with the Board of Nursing, the amount they have to cover. You know, I suspect they're overwhelmed. I really don't want to insult the Board of Nursing, because I think up to the more recent years, they've done a great job of, you know, keeping nurses maybe that have addiction or other things like all healthcare providers have, you know, they do a good job of, like, you know, holding those people accountable. So to me, this feels like a big kind of glaring red flag that we need to talk about and we need to do something about. Because unfortunately, like you're saying, when deaths occur, it ends up being like an outside Department of Justice, the DEA, something that sparks it against the nurse practitioner. And I think that's waiting too long.
For me, I think about those patients that were referred to the board, and I think about a process where the medical decision-making could have been evaluated. Right. And that's what really, that's what to me stands out. It's like, what could work? How would we get this to work moving forward? What sort of legislative options or regulatory options are there to allow the nursing board to demonstrate collaboration at a system level? Right. We're asking for collaboration between the Board of Nursing and the Board of Medicine, just like we're asking for collaboration at an individual level. So I think about those individual patients and what could have been done. You can go find this, go whatever state you're in, go to the Board of Medicine website, whatever state you're in, and literally peruse in all of our free time, look through the disciplinary summaries. They are amazing. And I'm biased, obviously, but the reason they're great is because they are so detailed and so patient-centered. And every, you know, when there's a medical physiology question, when there is an active medical diagnosis, that same question, the board takes their time and goes line by line, sometimes even minute by minute. What medication did they receive at what time? And was this appropriate? And conclusions are made about medical acts of diagnosis by a board of people who are trained in those medical acts. And the reason I use medical acts of diagnosis is because that's what nurse practitioners are doing. Despite the fact that they're nurses and despite the fact that they're regulated by a nursing board, they are doing these medical acts of diagnosis. And I would encourage you to go to also the Board of Nursing and see if that ever happens. You can kind of judge it by the type of consequences, like the disciplinary actions. And you can see where for the medical, they'll have remediation courses, or they have classes where they can send doctors to make sure that they're still, still good at practicing medicine. And I just don't see the same thing when I compare the two.
And it's also a really important point to make it clear, in most of these states, the Board of Nursing holds a nurse to what's called the minimum acceptable standard. So again, that's a really important point, that if they miss a vital sign, or if they miss something that we would consider significant, they often say, well, but nobody died as a result of that missed vital sign. And so it's really this kind of minimal standard. And I would say we don't do that with the Board of Medicine.
No, that's a great point.
Really, what I think is interesting is that patients have no idea about this. We interviewed Uni Kim, the friend of Stevie Ryan, who passed away after she was improperly treated by a nurse practitioner. And she said, she stopped us and she said, wait a minute, what do you mean Board of Nursing? And what do you mean he's not a doctor? And so, I mean, basically patients, I don't think the average patient really understands the difference. They just trust that the person they're going to in a white coat is going to take good care of them and has the best training. And that if they're not a good doctor or nurse practitioner, that someone will stop them. And unfortunately, that is not the case, at least what we're seeing in these cases. It's taking years for any action to be taken. So this is really important for patients to know about. And I think that, Teresa, I think your letter, that I don't think they published it, but I wish that they would have, just to point out to readers that as egregious as these acts were, and hopefully we won't see physicians doing it. If a physician was doing it, there's a lot more standardization and quicker action to get that stopped. And if nurse practitioners are practicing independently, then perhaps they should be regulated by an agency that's more aggressive, like the Board of Medicine.